Dr. Haushalter, what about in terms of children and adults? I noticed that this is something that we see in children as well.
Absolutely. We do have a lot of children with psoriasis. It's not as common as in adults. It usually comes up over the age of 18. Okay. We have teenagers who get it, children. My youngest patient was probably a 2-year-old.
Wow.
So it can certainly happen in children as well.
Okay, now there's different types of psoriasis,
yes.
and this is where you, the expert, comes in and tells us what kind of psoriasis are we seeing. You did identify joints and beyond skin as well. So can you give us a little example?
Well, the most common type I would say is plaque psoriasis, but there's something called guttate psoriasis. You just mentioned children, that children get, or teenagers, adults as well, after certain infections. So guttate, it just looks a little different on the skin.
Right.
And then there's psoriatic arthritis, which is when the joints are involved.
Right.
But there's a lot of different presentations on the skin as well. But it's red, it's scaly, sometimes itchy.
Okay. And how long does it last? I think that's probably one of the most the most popular questions you get from patients. Am I going to have this forever? Is there anything that can help it? So how long does psoriasis show itself in the body?
Well, the most common question is actually, why do I have this?
Okay, so let's answer. so why do I have this? And then the second.
Yeah, they always want to know, and we say, look, it's genetic. But once you have psoriasis, you kind of always have psoriasis.
Really?
Now, we can make it go away. We can make that inflammation look better. Their skin can look normal. But the minute you stop treatment, it at some point will come back.
So is that what's considered a flare-up?
Yes,
let's say.
Yes, absolutely. It can flare if they stop using their medication. It can flare stress. Obviously, triggers lots of inflammatory conditions, but especially psoriasis.